this is a helpful way to provide information. Helping with the webinar today are Jill Beckwith, the Deputy Director of Rhode Island Kids Count, Jim Beasley, Policy Analyst at Kids Count, and Cheryl Del Pico, a staff member with the HealthSource Rhode Island Outreach Team. Last but not least, Rachel Flum, Policy Analyst at the Economic Progress Institute, who is also the Project Manager of our Health Coverage Project and the Administrator for the webinar today. I'm going to turn the mic over to Rachel for some information about how the webinar works.
Hello, everyone, and thank you for joining us. Everyone is muted on the call today, but we will have several breaks for questions. So if you have a question, you can type it into the chat feature on the right-hand side, and then I will ask the question at the break, and we will respond orally to everyone. We're hoping that people can keep their questions to the specifics of this presentation. We know there are lots of questions around a lot of these issues. So if you have questions later, certainly reach out to us individually, or if you want to type the questions and then we can answer them offline at a later time. If you have any problems or if you did not receive the webinar, which we sent out this morning, please feel free to email me at rflum@economicprogressri.org. That's R, F as in Frank, L-U-M, at economicprogressri.org. Or you can use the chat feature on the right-hand side. This webinar will be recorded, and we will send out other information afterwards as well. Thank you very much.
Okay, so our goals for today with this webinar are to help all of you understand the transitional RIte Care renewal process, how to help families know how to renew and who can help them renew, and really to get everybody fired up to engage in a campaign to keep everyone covered. We know that there are lots of different organizations on the call and people with different levels of knowledge about affordable insurance and enrolling through HealthSource RI. We're assuming that all of you have some basic understanding about RIte Care, HealthSource RI, and eligibility to purchase coverage through HealthSource RI with tax credits. So let's start with who needs to renew, who's part of this transitional renewal process. There are 42,000 families who were covered by RIte Care in 2013. And under the federal Medicaid rules, families have to renew their coverage once a year. But because of the new system being put into place, the new HealthSource RI system, the Office of Health and Human Services planned to delay all of the 2013 renewals until 2015. But at the end of the last legislative session, as a budget decision, it was decided to complete all of the 2013 renewals by the end of 2014. So the state started a process of renewing 12 months of renewals in a 6-month period of time. And in addition, as we'll talk about in a little bit, there are another 5,000 families who received cash assistance, which is called Rhode Island Works, and RIte Care in 2013. They're not part of this 42,000, but they also will need to be renewing their RIte Care coverage. So all of the 42,000 families must renew between July and December of 2014. And families are needing to renew their coverage through the new eligibility system that's accessed through HealthSource RI. They're moving out of the old inroads eligibility system to HealthSource RI. That's why this is a transitional process of transitioning from inroads into the new HealthSource RI system. And not only is the process different, but the new Medicaid income rules, which are called Modified Adjusted Gross Income, or MAGI for short, will be applied when families renew their coverage through HealthSource RI. So just as a bit of background, the previous renewal process, and again, families had to renew on a yearly basis. If the families were only receiving RIte Care, they would receive a pre-populated form, paper form, from the state in advance of the time that their coverage was going to end, and they needed to return that form with any corrections that were necessary and with a month of documentation of their income. So that could be 4 pay stubs or 2 pay stubs. For Rhode Island Works families, those who were getting cash assistance and also RIte Care, prior to January of 2014, when families applied for or renewed their Rhode Island Works cash assistance, their RIte Care was automatically renewed along with their cash. RIte Care and Rhode Island Works eligibility were separated in January of 2014, and the families that were getting cash assistance in 2013 were not renewing their coverage when they came in for their cash assistance in 2014, and we'll talk a little bit more about that. So as we've mentioned, the new renewal process now, instead of getting either a paper application, paper renewal form, or renewing coverage along with the cash assistance, is now everybody of those 42,000 families needs to establish an account through HealthSource RI. So the good news is that once everybody is in the new system, things should be much better and much easier, because HealthSource RI will make an eligibility determination for renewal based on information already in the system and through the data matches that have been set up. And if they can get current information through those two sources, then they'll send the family a notice of eligibility and inform them of the information that's being used to make the redetermination or renewal. And if the information is correct, the family doesn't have to do anything. They will be renewed automatically, and this people have been referring to as passive renewal. If changes have to be made, then the family would send back the changes to HealthSource RI. And as a second route, if HealthSource RI can't make eligibility determinations based on the information already in the system or data matches, then they will send a pre-populated form to the family to review and provide information. So this is the process that will be in place for all of the families that applied for RIte Care after January of 2014 and started to get their RIte Care coverage through the new HealthSource RI system, as well as the Medicaid expansion population that first became eligible in 2014. All of these families will be coming up for renewal a year after they started to receive coverage through HealthSource RI. And then for all of the 42,000 families who are transitioned from inroads to HealthSource RI beginning in 2015, they also will have the passive renewal process applied to them. So we wanted to start with some really good news that, as we'll talk about, the state had first started a system of renewing all 42,000 families by sending cohorts of families notices over a 6-month period starting in June. And we'll go over those cycles in a minute. But as of August, now families can renew at any time, and they don't need to wait to receive a notice to do their renewal. This lets us, gives us a great opportunity to work together to help as many families as possible renew as soon as possible. Because starting in November, people who purchase private insurance coverage through HealthSource RI will need to renew their coverage for 2015. There will be open enrollment for Rhode Islanders who do not have insurance. That, again, will start in November. And this will all put a great demand on the enrollment system, the contact center, the navigators. So we all want to work towards getting as many of those 42,000 RIte Care renewing families renewed as quickly as possible. So that's our mission. But let's look a little bit at the deadlines of how this system is working. So as I mentioned, the 42,000 families were divided into 6 cohorts. Families that had last renewed their coverage in January or February in 2013, there were about 3,100 families, received their first notice in June with initially a closure deadline by the end of July, but because of a glitch with their notices, they got an extra month. Cycle 2, there were about 6,000 families who received their first notice July 1st with a closure date of the end of August. May and June, and going forward through the end of the rest of the cycles, there were about 8,000 to 8,500 families in each of those cycles who need to renew. And you'll see the dates here of the first notice that they received, and then the closure date if they don't complete renewal. So let's look a little bit more about the process and the notice that people of families. They received the initial yellow notice on August 1st, and if those families had not renewed by the end of the month, they got a reminder notice around September 1st telling them that they needed to complete renewal or would lose their coverage by the end of September. And these so these families are sort of in process right now, and if they fail to renew their coverage by the end by about September 16th, they will get a formal notice of closure from the state, and it actually comes from OHHS and DHS, telling them that they will be disenrolled from Medicaid coverage on September 30th, and they will be uninsured October 1st. There is a parallel process that happens because, as you all know, these families who are in RIte Care, by and large, are enrolling in one of two health plans, either Neighborhood Health Plan or United Health Plan. And the plans have an obligation to let their members know that they're being disenrolled from their plan at the same time that their coverage in Medicaid is ending. The plan will send the closure notice somewhere between September 16th and September 30th, informing their member that their coverage with Neighborhood or with United ends. If a family receives the closure notice and then they still can renew, and they should try to renew as quickly as possible. If they're in really fast, they could avoid closing to coverage in their health plan. But many families, if they renew between the closure notice, so in this example, September 16th, and the date of closure, in this example, September 30th, they will still be disenrolled from their plan for a period of time, but they will not lose their Medicaid coverage. And when somebody is disenrolled from their plan but still keeps Medicaid, they go into fee-for-service coverage through the Medicaid program. So this could protect the family if they're disenrolled from their plan but they still have fee-for-service Medicaid, and they go to a pharmacist and they would be able to fill their prescriptions. But if their doctor does not accept fee-for-service Medicaid, they may not be able to get those services paid for right away. So it's really important, again, for people to renew as soon as possible and not to be deterred if they get a closure notice. We want to still send the message that families should renew right away. And certainly, you know, what happens if the family loses coverage at the end of September and also has lost their plan coverage, they can still come in through HealthSource-RI and reopen to Medicaid coverage. If they re-enroll anytime during the month of October, coverage will go back to October 1st with fee-for-service Medicaid, and it takes about 6 days from the date that they re-enroll in coverage to then be re-enrolled in their plan. So again, the message is re-enroll as quickly as possible, but if you've missed any deadline, go forward and enroll. So let's just look back at the cycles, because at this point, people are in different places in terms of their renewal status. So cycles 1 and 2, which were the families that needed to renew by the end of August, those families received closure notices. And the numbers that we know so far are that between 6,500 and 7,000 children and parents were closed to RIte Care coverage at the end of August. And this is a little bit of a sample of the type of closure notice that they received. Again, these families should re-enroll as soon as possible. For families in Cycle 3, that's a September group that we were just talking about. These families received a yellow reminder notice at the beginning of September, and they're at risk of losing coverage at the end of September. There were about 24,000 people in Cycle 3 that received the notice. We don't know how many received the reminder notice, that is the families that have not yet renewed. But if the numbers hold true from Cycles 1 and 2, somewhere around 30% of the people who initially got the notice did not complete renewal. So we're looking at potentially another 6,000 to 7,000 people losing coverage at the end of September unless we can find them and help them enroll. Cycle 4, which are the families that received a notice on September 1st telling them to renew, there's about 8,000 of those families. So now we have people who lost coverage, a cohort of people who got a reminder notice to renew and are at risk of closing at the end of September, and then families that have just received their initial notice to renew at the beginning of September. And then again, to come full circle, Cycles 5 and 6, the families that are not scheduled to get their notice until October 1st or November 1st, they can now renew before they get their notice. And if they complete their renewal, they'll come off the renewal list. So the more of those folks we can find, the better. And there's the last group that we want to talk about, which are, remember, these are families that are not in these 6 renewal cycles. These are the families that get cash assistance and RIte Care coverage as well, and they're about 5,000 families. They received RIte Care and Rhode Island Works in 2013. When they went in to renew their cash in 2014, they were not asked to renew their RIte Care at that time. They were going to be in that same group of not having to renew until 2015. But now, because of the decision to move up the 2015 renewals, they will need to renew their RIte Care as well. They are not going to get notices through the 6 cycles, but they will be helped to renew when they come in to renew their cash assistance at the local DHS offices. But these are also families that, since people can renew at any time, we can find and help them renew. And if you think about where these very low-income families are, those of you who operate Head Start programs, or if you have connections with subsidized housing programs, those are prime places to be thinking about getting information out to the families and helping them link to the renewal process. So you're all feeling confused, oh my God, there's so many different groups. It's true, there are different groups, and now we have 5 of them, but the question is really the same for every family. Did you have Neighborhood United in 2013? And if yes, did you renew your coverage, or did you enroll through HSRI? And if the answer to that is no, then we want to help those families link to renewal. And it doesn't matter whether the family has already closed, or they got that initial notice, or they just received a reminder notice, or they were on cash assistance, or they are the families that will be coming up for renewal in October, November. Any family that received RIte Care in 2013, we should be finding and helping to get into the new HSRI system. So we just want to talk about a couple of special circumstances to be on the lookout for. And for those of you who work with people with disabilities, this first issue will be of particular import to you. There are many families in which some family members receive RIte Care based on their income, but there is also a family member who's receiving SSI because it's either a parent or a child who has a significant disability. People who get Medicaid based on a disability are not being renewed at this time. So if it's a mixed family, say it's mom and dad and one child who are getting RIte Care based on their income and a child with a disability who's receiving SSI benefits, then when that family goes to renew, they list the child with a disability in the application because it's important to know the accurate family size, but that child would not be requesting coverage through HSRI, and that child's coverage will continue in their special SSI category. If they mistakenly list that child as requesting coverage, sort of no harm. They'll just see in the system that the person, that individual is not eligible for coverage because they're not eligible under the MAGI coverage category. Similarly, if there's a child who's a foster child who's in the family wants to include the foster child in their application, but the foster child's Medicaid coverage is not being renewed at this point. They cannot lose their coverage. They don't have to request to have their coverage, but they want to be listed as part of the family cohort. What about families who are enrolled in RIte Share? And just as a reminder, RIte Share is the program where a worker enrolls in their employer coverage and the state pays the employee share of the premium. The eligibility rules for getting covered through RIte Share are the same as RIte Care, the same income limits, etc. It's just that the way that they get their coverage is through their employer coverage. If a family, these families are not in the renewal cycles yet, although we have heard that some families in RIte Share have been have received a renewal notice. So if a family that's in RIte Share comes in and has a renewal notice, you can help them renew. And when they get to plan selection, it sort of doesn't matter what plan they pick because the RIte Share unit at OHHS will pick up that family and they will be kept in RIte Share. What's very important to tell a family that's in RIte Share is that they should not drop their employer coverage. And the last group is family members, if a family member has Medicare, not Medicaid, but Medicare. That family member would be included in the application, but also listed as not requesting. So those are four sort of special circumstances to be on the lookout for. And I'll just say that the first two groups, the family members, the families that have a member receiving SSI or where there is a child in foster care, they are included in the renewal cycles. The RIte Share families are not yet in the cycle, and the family members, the families where a member has Medicare are also in the renewal cycle, so they may have been getting notices. So we're going to stop here for questions. And
yes. So, so far we have one question, and it's just a reminder to folks, if you have a question, we need you to type it on the right-hand side of your screen in the chat box or in the question box if you have that. If that is not working for you, you can also email me questions at rflum@economicprogressri.org, and we will answer them on the webinar or respond at a later date. So our first question, and our only question right now, no, looks like we're getting some more. So our first question today is, what is the deadline for the Rhode Island Works families? December 31st or for all of them?
That's a great question, and I don't know the answer at this point. do know that as families are coming in for cash assistance renewal now, so September, October, November, December, DHS staff are helping to do renewal for those families, but that still leaves all the January through August families that renewed their cash coverage and didn't renew their RIte Care coverage. So we will follow up and find out what the plan is from DHS to let those families know that they need to renew. I mean, just to make what hopefully is an obvious point, these families, any of the families that get cash assistance, cannot lose their RIte Care coverage until they're given a notice about the need to renew and 60 days to complete their renewal. So just as we've had the 6 cycles for the 42,000 families, and you saw that the families that got an initial notice on August 1st were those who had to renew by the end of September, so they had 60 days to renew. That would be true for the cash assistance families as well, and we will find out what the plan is to try to pick up those families, and we'll send out an email as soon as we know that.
Okay, great. Our second question is, can you review what MAGI means?
Sure. So MAGI stands for Modified Adjusted Gross Income, and it is a new way of determining income based on tax returns. So the adjusted gross income is the adjusted gross income on the bottom of a person's first page of their tax return, and it uses the tax rules to determine what income is counted, and it's modified because there are some changes to the tax rules that are applied in determining the income that is used both for Medicaid and for determining the amount of tax credits that applicant individuals and families can receive. I don't think we want to go into more detail about how MAGI is applied. I will note, too, that there are some differences in terms of household composition for purposes of determining tax credit eligibility and Medicaid eligibility. As an example, if there is a grandmother raising a grandchild and the grandmother claims the grandchild as a tax dependent, they are considered one household for purposes of determining the tax credit to which grandma and the child are eligible, but that child is separately eligible for Medicaid, for RIte Care, based on the child's own income. So if there is an interest from folks to go over in more detail some of the MAGI rules and the differences in households, we'd be happy to provide that information. So people can just let us know.
Okay, our next question is, for individuals with Medicaid, should they be reapplying right now or should they wait to receive something in the mail?
So the individuals who are getting RIte Care coverage, so that's the coverage based on a family's income. If they got RIte Care in 2013, they should be renewing now. If they started to get RIte Care in 2014, they should wait. They will get information about how to renew their coverage. So we're only talking about individuals who got RIte Care coverage based on income in 2013. People who are elderly or disabled who get Medicaid coverage based on their age or disability, they are not part of this renewal process. But as we discussed, sometimes there are families in which a person with a disability is getting Medicaid coverage while other family members are getting RIte Care. And in that family circumstance, the family members who are getting RIte Care need to renew. They want to include the family member with a disability in the application, but that person does not need to be asking for coverage, i.e. they're not asking to renew their coverage at this time. So nothing changes for aged, blind, disabled individuals who get Medicaid coverage based on that characteristic.
Okay, and our last question for this section, which is a good segue, is if there is a family member that does not currently have health source benefits, when is it okay for them to apply?
So an individual can apply for Medicaid at any time. However, if the question meant if can they get coverage from Health Source RI if the person is above the Medicaid limit and is applying for commercial coverage with a tax credit, that coverage has an open enrollment period which ended in March. But there is what's called a special enrollment period for people to be able to enroll if certain circumstances happen. So for example, if a person was working and they lost their job in May and they lost their health insurance coverage in May, they can apply for coverage, for commercial coverage with a tax credit. Or if a new baby was born to a family, or if there's a divorce and circumstances have changed, or a family just moved to Rhode Island, say they just came to Rhode Island in September, they have no health insurance coverage, they can apply through Health Source RI, and if their income is below the limits, they may be eligible for RIte Care. If not, they're eligible under the special enrollment period to get to buy coverage through Health Source RI and be eligible for tax credits. And we should just mention that the new enrollment period for Health Source RI for the commercial coverage is going to start in November for coverage that would begin in January. There's also information on our website about special enrollment periods for coverage. And again, just remember that if a person is eligible for Medicaid, for RIte Care, they can apply at any time. There's no fixed enrollment time. And again, for Health Source RI coverage, for the commercial coverage with tax credits, right now if a person qualifies for special enrollment period, they can get covered as well. Okay, so we'll move along, and actually Rachel's right. The question about the Health Source RI coverage is a good segue into just looking at affordable coverage, because here's an example. So let's we can do an example based on this chart. What this shows you is let's take a family size of 3. So that could be mom, dad, and 1 child. If the family's income is below $2,276 a month, then both the parents and the child will be eligible for RIte Care coverage. And that is the income limit of 138% of poverty, which is what the parent's income limit is for RIte Care. If the family income is between that amount and $4,387, then the parents are not eligible for coverage, but the child is eligible for coverage. So the child eligibility is about 260% of the poverty level, so a much higher income level for RIte Care for kids. If the family's income is above the $4,387 but below the $6,597, then the family is eligible to buy coverage through Health Source RI and get a tax credit to help them pay the monthly premium when they buy commercial coverage. And then if you look at the state premium assistance for the parent, if a family's income is below 175% of poverty, which is what those numbers are, then the parent's not eligible, right, because that income is above the $2,276, but the child is eligible for RIte Care, and the state will provide an additional help in paying for the monthly premium to buy commercial insurance. And we'll show an example of this in a minute. But if we go back to the question about can you buy at any time, let's say a family just moved to Rhode Island and they are uninsured and they're applying for health insurance coverage through Health Source RI today. Then if their income is below the $2,276, everybody comes on RIte Care. If their income is between that amount and $4,387, the children would come on RIte Care, and the parent, because it's a special enrollment period reason, they just moved to the state, would be eligible to purchase insurance coverage through HealthSource RI and get a tax credit. And then if the income was below the $28.86, the parent could get the federal tax credit as well as some help from the state to pay for coverage. A little bit more about the state premium assistance. This was created 2 years ago when the state rolled back the parent eligibility for RIte Care from 175% of poverty to 138% of poverty. And it's a way of trying to make the parent's coverage a little bit more affordable. You'll see here a copy of the application for the state-funded assistance to pay for health insurance coverage. The difficulty is that when a family applies for coverage on HealthSource RI, the parent can see what the federal tax credit is and how much that will reduce their out-of-pocket costs to pay for the premium, but it does not show them how much they can get from the state to pay for the coverage. The parent has to submit a paper application, and you'll see here a link to download that application. The parent pays the premium and then is reimbursed by the Office of Health and Human Services, or reimbursed by the state. This is the income chart that shows the limits per family size and the amount of the state premium assistance that is available. So again, for example, if you had a family of 3 and their family income was less than $29,685 a month, the kids would be in RIte Care, the parent would buy health insurance coverage and would be able to get $49 from the state to help pay for that coverage. And here's an example that hopefully pulls those strands together. And this can happen when families renew now. The 42,000 families are going through renewal. If the income has increased from 2013, it may be the case that the parent is no longer eligible for RIte Care, and they would flip from RIte Care into coverage through HealthSource RI. So here's an example. Liz works as a dental assistant and has 2 kids. When she's been on RIte Care all along, but she's had a recent raise, and it flips her income up to $34,000 a year or $28.80 a month. So the kids will still be eligible for RIte Care, but Liz has flipped from RIte Care into needing to buy coverage through HealthSource RI. So when she goes to buy coverage, the cost of the plan to her, the silver level plan, will be $280 a month. And this actually will be changing as the new rates go into effect, but this is the current amount, $280 a month. She's eligible for a tax credit of $136 a month, so she would have to pay the difference of $144 to HealthSource RI. HealthSource RI will then pay her health plan, and Liz can submit that paper application to the state for premium assistance, and she would be eligible for another $43 a month. And she would get that money back from the state. She would be reimbursed from the state. So Liz's net cost to buy coverage is $101 a month. The challenge, again, is that when Liz goes online, she will see that it would cost her $144 to buy coverage because that $43 does not yet appear on the HealthSource RI website. So as community helpers, if you keep that chart that we showed a little bit earlier with you, you can say to the applicant, well, this shows you that you're going to pay $144 with your federal tax credit, but I can help you fill out this paper, the application, and mail it into the state, so you will get another $43 back, and your actual out-of-pocket cost will be $101. And that $40 difference may be what encourages Liz to buy or not to buy coverage, because these are all families that are sort of living on the margin. So we hope all of you will sort of be ambassadors to talk about the state assistance. And this is not just for families that are already on RIte Care. It's also for families that are applying for the first time. Remember that family that we said was moving to Rhode Island. If Liz just moved here and had a job as a dental assistant and she was an applicant, she is eligible for the same state assistance. So we're going to just take a pause here if there are any questions.
Okay, yes, we have several questions. Let's answer the first one that is about the Liz example first. Does a parent have to submit the reimbursement form monthly to HHS?
Yes, they do. I should mention that the plan is to, at some point, incorporate both the information about the eligibility for the state assistance and the access to it in the HSRI computer system. It's just it's in the queue to be done, but we can't say when it's going to be done. But yes, she does have to submit the form monthly. So that's a great question.
And the follow-up question is, will the state premium assistance be provided to the applicant on a monthly basis?
Yes. I believe that the application is submitted. The state reviews to see that the person has actually paid their premium to the health plan, and then will reimburse on a monthly basis.
Okay, our next question is, does this apply to families that have coverage through their work, or is this all the same guidelines for RIte Share?
So RIte Share families should also be able to receive the premium assistance, although generally families that are in RIte Share are families in which the entire family is eligible for coverage. So it's mostly families with income below 138% of the poverty level, where both the parent and the kids are eligible for coverage, because once the parent isn't eligible, it may not be cost effective for the state to purchase coverage through the employer.
Okay, and then will HSRI inform the individual about the state assistance?
Well, as I mentioned, the computer system itself does not, but hopefully the contact center staff who help families apply, individuals apply, will tell the person about the assistance as they're helping them either walk through the application online or do an application over the phone. And we know that all of the navigators are familiar with the state premium assistance, and when they're sitting down with somebody to do the application or the renewal, we'll tell them about the state premium assistance. But again, unfortunately, there's nothing on the website itself or in the application, the online application, that notifies the applicant about the availability of the state premium assistance. And you can find on our website both a copy of the application as well as the chart that we just went over that can guide you about the amount of assistance that the parent is likely to receive. So again, just want to emphasize that the state premium assistance is available for families in which the children are in RIte Care and the family's income is below 175% of poverty. Any other questions?
Yes. So we have a question that says, about someone like Liz, there are plenty of people in her situation, maybe even make a little bit less than the amount. Say a single mother with several children makes around that much a year, so she qualifies for coverage through HSRI, but that $101 can be the difference between getting health care and paying the electric bill. Is there a safety net in place for people like this?
So if it was a larger family with this income limit, they would all be eligible for RIte Care. So I may be missing the point of the question. There are certainly even in Liz's example, or for families that are larger and the parent is not eligible for RIte Care because they're just above the RIte Care income limit, even with the state, with the federal tax credit and with the state tax credit, we know that it is a stretch for families to be able to buy coverage for the parent. And when the parent eligibility for RIte Care was reduced from 175 to 138, we knew that as families went to buy coverage through HealthSource RI, not all of them would really be able to afford it. So that's an issue that we will continue to work on as a community in terms of other ways to make coverage affordable for all Rhode Islanders.
Okay, now this may be a question for Cheryl. This is more a process question for applying for folks to renewal. When a household member is going on to renew for a son, for instance, should they enter that they're still looking for coverage for themselves if they are on QHC or on RIte Care themselves, or should they enter no? Or is this a question we should answer later?
Yeah, let's hold on to that one.
Okay. Then how about this one, Linda? Can you just briefly describe the difference between Medicaid and Medicare?
Sure. Medicare is the coverage, health insurance coverage that people become eligible for when they reach age 65, or if they have a disability and they are found eligible for Social Security disability insurance. And then they become eligible for Medicare coverage 24 months after they have been found eligible for disability benefits. So let me just back up and say Social Security Disability Insurance, or SSDI, is the cash that people are eligible for if they have worked and paid into the Social Security system. So that's SSDI. There is also the federal, basically, welfare cash assistance program for elderly people and people with disabilities called SSI, which stands for Supplemental Security Income. That cash benefit is about $700 a month. If somebody has never worked and paid into Social Security, so they're not eligible for SSDI if they become disabled, or Social Security retirement benefits when they reach age 65, then they would get a full SSI check instead. But there are many people who have worked and paid into the system whose Social Security benefit, either disability or retirement, say is $500 a month. Then they would get a supplemental payment from SSI, Supplemental Security Income, of the difference, so about $200 a month. A person who gets just disability insurance will get Medicare. The person who gets SSI will get, and does not have Social Security, will get Medicaid. And if the person gets both SSDI and SSI, they will get both Medicaid and Medicare. So you can sort of line up SSDI or Social Security retirement with Medicare and line up SSI with Medicaid. This is another area that I know is complicated for folks. And if this is something that it would be helpful to have a brief webinar about in terms of understanding issues affecting people with disabilities, that is something that we can look to set up, so let us know. Any other?
So yes, I think this, you can answer this pretty quickly. So if there's a family of 3, and a parent gets medical through the employer, one child gets RIte Care, the other child used to receive SSI, but because of the parent's income no longer gets SSI, would both children be covered? And I think the answer is it would depend on whether the income is still below the limit for it to now be a household of 3. Correct? We can answer that question
So
offline.
that is general. That is correct. And there is a window where the way that SSI eligibility for a kid is determined takes into account their parents' income, where the child could be losing the SSI coverage but still be eligible for RIte Care based on income. So it is definitely income-based in terms of looking at that family's income, and you could do a quick check by looking at the income chart on the slide to see whether the family's income, if it's a family of 3, if the family's income is below the income limit for kids. So it would be below $4,387 a month, just as a rough estimate of whether the children remain eligible for RIte Care. I mean, basically, if the first child is getting RIte Care and the current income is being counted by the state, and the second child lost their SSI, then that second child is going to be eligible for RIte Care as well. If there has been a change in income which has not been reported to the state that could impact the first child's income, then it may be that neither child is eligible for RIte Care. So it's a little hard to answer the question, but I hope you get the reasoning. If child 1 is eligible and income hasn't changed, child 2 is going to be eligible even though they lost SSI.
And that is all we have for right now.
Okay, great question. So thank you. All right, we're going to look a little bit. We did want to do a little bit of basics. So we wanted to cover a little bit about immigrant eligibility for RIte Care coverage and also purchasing coverage through the exchange, so for across the range of affordable health insurance products. And I just want to emphasize that for immigrants, it's not a special eligibility category. Immigrants have to meet the income and other eligibility rules for RIte Care coverage or to buy coverage through the exchange. But while all citizens are eligible for RIte Care or to buy through the exchange, not all people who are not citizens, i.e. not all immigrants, are eligible for coverage. And it's a little bit of a patchwork of how this works, so we just wanted to go through this. And we will soon be releasing, sometime this week, a fact sheet about immigrant eligibility for RIte Care and HSRI coverage that we hope will be helpful. But just to go over this briefly, because what could come up here is a change in immigration status since the last time the family was renewed might provide some new coverage for some family members. So the largest category are lawful permanent residents. Those are people who hold a green card. They've been sponsored into the country by another family member. Children under the age of 19 are going to be eligible for RIte Care. A pregnant woman is going to be eligible for RIte Care, but single adults or parents who are lawful permanent residents are not eligible for RIte Care coverage until they've been in status for 5 years or they entered the United States before August 22nd, 1996, or it's a veteran, active duty military person and their spouses and unmarried children. For people who are refugees, were granted asylum, are victim of trafficking or certain violence either by a partner or a stranger crime, all children, pregnant women, and adults are all eligible for RIte Care or Medicaid coverage immediately. There's no waiting period for the adult. Then there's a group of people who are lawfully here, but they're neither refugees or asylees, and they don't have a green card. So an example would be Liberians who live in Rhode Island. There's a large community who have what's called deferred enforced departure. So they're legally here. The government knows about them. In those cases, both the children and pregnant women are eligible. The parents are not eligible, and they never will be. It's not that there's a waiting period to become eligible. They are just in a status that does not qualify them for full RIte Care coverage. And finally, for people who do not have a legal status, so they either overstayed a visa or they came across the border without papers, The only category of people who are eligible for RIte Care coverage are pregnant women. And when that baby is born, the baby is a citizen, so the baby is eligible. The pregnant woman, who is now no longer a pregnant woman, but a parent, is no longer eligible for RIte Care after 60 days postpartum. And then you can see in the column for purchasing HealthSource Rhode Island, coverage through HealthSource Rhode Island, and qualifying for tax credits and cost-sharing reductions. As long as the person has a legal status, they're eligible to buy coverage through the exchange, but undocumented people cannot buy coverage through the exchange. We also want to highlight that there are many circumstances where there is an undocumented parent who has citizen kids, and in that case, the undocumented parent can apply for his or her eligible citizen children. That parent, if they don't have a Social Security number, obviously they're not providing one. They are not requesting, they're not asking for coverage. Their information is held secure. They will not be reported to the immigration services, and we know that there can be a lot of fear in the community about, particularly now, applying through a website, but those parents, it is safe for them to apply for their citizen kids. This next slide shows you gives you a little preview of our immigrant eligibility basics that will be coming out this week, and that we'll be sending out to all of you, and you'll be able to order this in both Spanish and English. It's a double-sided document with eligibility information and then some highlights of issues to consider for people who are not citizens who are applying for coverage. So we're just going to take a break here to see if there's any questions particularly about immigrant coverage.
Yes, we have one question that pertains to citizenship and Medicaid eligibility rules. So if, for instance, there's a family of 4 and 3 of them are legal citizens with income below $30,000, does Medicaid count a family of 4 for eligibility of income, or just a family of 3 because only 3 of them are citizens?
It should count a family of 4. It should count all family members, even if the parent is not documented and not eligible.
And that is all the questions we have right now on that.
I should just add that even where an individual is not eligible for full Medicaid or RIte Care coverage, if they have an emergency and wind up in the hospital, the hospital can submit an application for Medicaid coverage if the person has had a life-threatening occurrence, and Medicaid can pick up those bills. So if it's an undocumented adult, for example, with income below 138% of poverty, who otherwise would have been eligible for Medicaid coverage under the expansion, if they wind up in the hospital, they can have those hospital bills covered even though they can't get full Medicaid coverage. Okay, we're going to turn now to some process issues. So let's talk about how to renew. And this this slide is actually a picture from our flyer, which we hope many of you have seen, that is Spanish, English, back to front, about advising people that they should renew and then talking about how they can renew. So people can renew over the phone. As this says, it's fast and it's accessible in the person's native language through the language line. This phone number, the 1-855-651-7879, is a special number at the contact center which advises people answering the phone that this is a renewal, not a new application. The good thing about the phone renewal is a couple things. One is it's available Monday through Saturday from 8 a.m. to 9 p.m. and on Sunday from noon to 6 p.m. So particularly many of those 42,000 families are families in which the parents are working. So this makes it easy for them to go on the phone and renew when they're not at work. The second way to renew is to renew in person, either by calling the contact center and going there in Providence to make an appointment, or there's a network of experts who are called navigators that are all around the state who are, as we say, experts in helping people renew, know all of the details, can solve problems if there are glitches, and you can find the list of navigators on the HealthSource.RI website, and there is a new brochure that's coming out shortly with a list of all of the navigators that we'll post on our website, and we'll also mail out to folks. We'll work with the HealthSource.RI and Rhode Island Health Center Association in making sure that people have those brochures, so people in your agencies can just have a document to be able to look up and say to a client, oh, I see there's a navigator right near your home. Let's make an appointment with that person, and you can go see them tomorrow or the next day. Again, the contact center is open at the hours that you see here, and navigators in the community often have hours that are outside of regular business hours, and there are also navigators who speak languages other than English, so it's a great resource for folks. People can also go to their local Department of Human Services office to do their renewal. The third way is to renew online, and you have the link here for how people can start the renewal process online. If people get stuck when they're renewing online, they can call the contact center at the number that you see here for help. I guess we would strongly advise that people do the renewal either over the phone or in person with a navigator or at the contact center. I think that everybody's experience has been that while the hope was that doing an online app would be simple, there are a number of challenges for people to get through when they try to do it by themselves. The fourth way, the fourth way that people can renew is to download a paper application at that same eohhs.ri.gov/renewals. They can print out an application. It's about 20 pages long. Again, it's not a way that we advise people to do the renewal because there will then have to be lots of follow-up in terms of documentation that might need to be provided. So again, over the phone, in person with Navigator or at the contact center is really the quickest way for people to do the whole thing and also ensure that it goes through quickly. So just for those of you, I know many of you on the call are very familiar with this, but this is sort of a high-level graphic of how people use HealthSource.RI. There's an online portal at healthsourceri.org. The consumer would log on and set up an account. And again, if they're doing this on the phone, the contact center staff person would be doing this for them, or the navigator would be sitting with the person as they're doing it. They put information into the system. There is a check with different databases that the system performs to determine eligibility. If the income is within the RIte Care limits, then the individual is told they're eligible for RIte Care coverage. If it's above the limits, they're told they're eligible to buy coverage through HealthSource.RI with a tax credit, and it tells them how much their tax credit is and what it will cost them each month to buy coverage. Remember that what's not there is the state assistance for people whose income is below 175 and whose kids are in RIte Care. And then if the person is eligible for RIte Care, they pick either Neighborhood or United as their health plan. And if they're eligible for a subsidy, then they can enroll in Blue Cross or Neighborhood as their health plan. And there will be more health plans and more choices coming up for 2015. You'll see here it says no change of RIte Care plan. When people are renewing coverage, if they're in Neighborhood now, they need to stay in Neighborhood. If they're in United now, they need to stay in Neighborhood. There will be an open enrollment period for people who renew and are in RIte Care where they can switch their plan, but that won't be coming up until sometime in March. So for right now, families in RIte Care, in Neighborhood stay in Neighborhood, families in United stay in United. As you're talking to your clients or customers, information that they want to have ready when they go to do their renewals are Social Security numbers. They don't need the card, just the number. If it's an immigrant, immigration documents, their latest tax return, and current pay stub if they have it. And then again for the renewal process, which is also, the renewal process is really a new application through HealthSource RI. But I'm going to talk about it a little bit of a protection for people who are renewing. So the steps would be opening an account on HealthSource RI. People have to answer security questions. They have a username and they have a PIN number. They're asked whether they have an email account, and if they don't, they need to put in an email account, but they want to make sure that in the section where it talks about how do you want to receive your notices, they say by mail, not by email, because they're not going to be using their email to get notices down the road. But it is a question that they have to answer to keep going through on the application. So then they would go through, complete the application. If they have questions, they can call the contact center. This is sort of assuming the person is starting online themselves. Things that come up are both ID proofing, because the system will send out to see whether the person is who they say they are. And this can cause sort of a stop for people, especially people who don't have credit histories, so lower income people, which is a reason that, again, we advise that people do the application over the phone with the contact center or with a navigator, because there is a way to do the ID proofing right away without getting a notice that says, our system says we don't know who you are. You now have to bring in proof of who you are to the welfare office or to the contact center. So a streamlined way, again, of doing this is phone, navigator, go to the contact center. And then the system will also send out to do a data match on the person's date of birth, their Social Security number, their citizenship, and their immigration status. I just want to point out, and this is getting a little bit in the weeds, but since as people are renewing, people who are already on RIte Care cannot be asked to re-verify their date of birth, their citizenship, or their date of birth, their citizenship or their Social Security number. So if somebody makes a typo and puts in their Social Security number with the wrong number, and the data match goes out and says this is the wrong social, that person should not have to bring in a paper copy of their Social Security number. The system should be able to figure out that this is somebody who was on before. Their social was verified the first time they were applied for RIte Care, and they should never lose their coverage for failing to verify that that particular criteria for coverage. So date of birth, citizenship, or Social Security number. From a practical point of view, if there is a problem, maybe bringing in the paperwork is the simplest thing to do, but something to monitor for is if the person doesn't bring in the paperwork, they still shouldn't be cut off for failing to bring in documents. Because this is renewal, even though it's moving from one system to another. So now for sort of your part of, hopefully you've been thinking as we've been talking through these slides about what can I do in my agency to make sure that everybody that I see is screened for whether they need to renew. And you all come from different programs. Some are at health centers, some are health clinics, dentist offices, WIC programs, CAP agencies. What we're hoping is that you will figure out as a community in your agency how to screen every single family that you're seeing to determine whether they need to renew. And again, the screening questions are, did you have neighborhood or United coverage in 2013? Because we know that most people think about their plan, not whether they had RIte Care. And have you renewed your coverage through HealthSource RI? Have you gone online or talked to a navigator? You might have to ask a couple probing questions. But if they haven't renewed, then you want to figure out how to connect that consumer to renewal. If there's a navigator where you work, that's great. You can, pick up the phone. If you're a CAP agency and there's a navigator at your health center, you can pick up the phone and call the navigator and see if they can see the person right then or make an appointment. We want to really try to connect everybody with a way to renew at the moment that somebody at your agency touches them. If you can't connect right away to a navigator, perhaps the staff member has enough time to sit with the parent and pick up the phone and say, let's call the contact center and you can renew right now. It takes 20 minutes or so to get through the process. We have not heard that there are long waits to get to talk to someone, but if that starts to grow, we would like to hear about that so that we can talk with the contact center about making sure that people are not on hold for long periods of time. So again, family home visitor goes to the family's house and finds out that the parent was covered by United or Neighborhood in 2013 and has not renewed. Maybe they got terminated. Maybe they have a yellow notice. Maybe they're coming up in October, November. Maybe they're a cash assistance family. If that home visitor can sit with the family for 20 minutes and do the renewal, it's done. And we'll know that that family is covered going forward for another year. If your staff person can't sit with the family to do the phone enrollment, then make an appointment with a navigator or at the contact center. And again, we'll get the navigator brochure out to try to make it as easy as possible for staff to pick up the phone at a navigator agency, say to the parent, when can you go, who do you want to see, and it's a great way to connect somebody with making sure they're going to have coverage. And it's sort of the last resort would be to give the consumer the flyer that we have with information about how to renew, and hopefully then to follow up with the consumer to see whether they did it. We are going to be posting on our website shortly a number of resources. Here's the flyer that you can download. You can also order them. We have very pretty looking back-to-back Spanish-English flyers. We have thousands of them, and we would love for you to order some and have in your agency. You could get these and you could put a little sticky on the bottom of it or somewhere to say, if you haven't renewed, speak to X, so that people coming through your doors see that you're concerned about helping them to renew. If every receptionist could say, could check with somebody when they're coming in about the RIte Care coverage, and you could figure out a pathway to connect those folks to somebody in your agency to help them renew, that would be great. We also have this handy-dandy little infographic that you'll be able to share on your social media, whether that's your website or you can tweet out to folks, and we'll make that available as well. We also will be posting sort of a suggested business process, how to think through how do I organize things in my agency to make sure that we're finding and renewing all the families that we serve. And again, we hope you'll think broadly. You might have a program in your agency that's doing LIHEAP, and if we can keep people covered with health insurance coverage, that would be really important. So try to think outside of the box and outside of silos, and let's all figure out how we can get everybody enrolled as quickly as possible. So we have a couple more slides to talk about, some bonus information for those of you who have held on this long, but we just want to see if there's any questions about what we covered so far.
Okay, so we have a couple questions about who is eligible. One is, well, not eligibility, but can you renew over the phone if your insurance has been canceled?
If the RIte Care health insurance, if the question is about RIte Care health insurance, the answer is yes. So for the 6,500 to 7,000 children and families, which maybe is about 2,000 families that lost their coverage at the end of August, they can call up and say they're technically they're still renewing, but it's an application. I mean, everybody really is doing a brand new application through HealthSource RI, even though we talk about it as renewing their RIte Care. Everybody is setting up a new application, a new account in HealthSource RI.
And similarly, if a parent needs to renew but only the children are covered, can the parent apply at the renewal?
So if the parent is uninsured and the kids are getting RIte Care, if the family income is below the 138 limit, so below the child and family limit that we had on the chart, just looking for that as we're so if it's let's say it's a family of 3 and the kids have been on RIte Care but not the parent, and the family income is below 2276, which is the limit for the parent as well, then yes, the parent would be enrolled at that time in RIte Care. But if the parent is uninsured and the kids are on RIte Care and the parent is above the RIte Care limit but within the limit to buy coverage through HealthSource RI, they will not be able to buy right now. Remember, it's not open enrollment time for HealthSource RI unless they meet one of the reasons for the special enrollment period. So I realize that's a little bit complicated, but another reason that families like that should certainly call the contact center to enroll, to renew, and ask about whether the parent qualifies for a special enrollment period or to sit with a navigator. And if the parent doesn't, and there are a lot of parents who lost their coverage at the end of December 2013 when eligibility was rolled back from 175 to 138. So in January, we had about 1,000 parents whose kids were still in RIte Care, and the parent was no longer eligible for RIte Care because their income was too high, and they didn't buy coverage through HealthSource RI. Perhaps they couldn't afford it. Perhaps they never started the process. They didn't understand it. If those families are renewing now, unless the parent's income has gone down below the RIte Care limit, those parents will need to wait until November to enroll themselves through a plan through HealthSource RI when open enrollment starts for HealthSource RI, and their coverage would start January 2015. We will be doing another presentation, either a workshop or another webinar about the open enrollment periods and renewals for both the 2015 populations and the open enrollment through HealthSource RI, where we'll talk a little bit more about issues like this with parents who are uninsured and kids who are in RIte Care. But the simple answer to that question is, if the parent is now uninsured and the kids are on RIte Care, unless the parent's income is below 138% of poverty, which you can see on our chart, or the parent qualifies for a special enrollment period from HealthSource RI, they are going to remain uninsured until open enrollment starts, and they won't have coverage until next January.
Okay, and then we have 2 more questions that are related to what happens when a child is over the age of 18. So what happens when a child turns 18? Are they still covered until what age? Or also another question is, when a young adult has insurance through their parents and they're working, are they required to drop the parents' insurance and get their own insurance, or are they allowed to continue coverage through the family plan?
So kids are eligible for RIte Care until they turn 19, and the children are eligible to stay on their parents' health insurance coverage until age 26. But if they are not, if you had a young adult, for example, who was working and earning less than 138% of the poverty level, and they were age 19 or older, if the parent chose not to keep them on their family coverage, that young adult could enroll in RIte Care coverage if their income was below 138, or could buy their own coverage through the exchange. But if they're not eligible for RIte Care, the most economical thing is probably going to be to have that young adult stay on their parents' coverage. So we'll just finish up with our last two slides. One is good news and one is not so good news. I know we're coming to the end of our time together. So we just want to let you know about another resource that we have available, and hopefully all of you know that one of the changes that the Affordable Care Act made was to expand coverage for youth who age out of foster care. It used to be that when a youth aged out of foster care, they got RIte Care coverage until they turned 21. Now they remain in coverage to age 26. And there are a cohort of young adults in Rhode Island who lost their coverage when they turned 21, but now can come back on because they're under the age of 26. So the process for enrolling for them is through DCYS, not through HealthSource RI. We have a flyer that explains this and some instructions for folks about how to help young adults enroll. So we hope you'll download that, post it at your agencies, especially those of you who work with former foster youth, to let them know that they can now get coverage, this free coverage through RIte Care until they turn 26. And lastly, some not so good news. As everyone knows, while Rhode Island has been great in terms of getting the exchange, our HealthSource RI, up and running and getting thousands and thousands of Rhode Islanders coverage, I think we're second in the nation for doing that. It's not all been a smooth ride, and one of the things that happened was that when the Medicaid expansion folks, the adults who newly became eligible for Medicaid at the end, beginning with January 2014, or if it was a RIte Care family that applied through HealthSource RI instead of the old RIte Care paper application, there was a glitch with income verification. And so there were about 4,000 people who were notified in July that they needed to provide proof of their income to the state. And if they failed to provide the proof of income, they were closed to coverage at the end of August. And there were 4,000 people. This includes both children and parents in RIte Care, as well as some of the expansion population, the single adults. So you may see people coming through who say, yeah, I applied for coverage, but now I'm cut off. And those would be people who got a notice that said, you failed to submit proof of income as requested, you were closed at the end of August. So that's another group. Again, same rules. Find them, inform them, advise them to call the contact center to enroll or see a navigator. They can start coverage up. Again, if they're still RIte Care eligible based on the income that they'll now be reporting, they'll be in RIte Care. If they were not eligible for RIte Care because their income is too high, they would buy a plan through HealthSource RI. And lastly, here's our contact information. You have Rachel's contact information as the project manager, my contact information. We're always happy to answer questions or find out the answer to questions for you. We hope you'll join our e-news to be kept up to date on the RIte Care, both RIte Care renewal issues and other health coverage issues. And we look forward to continue to working with all of you. Thanks for participating today.